to your program of choice, Healthaffair on AIT, a platform where we focus on public health issues, challenges of women and children with a view to foreign lasting solutions. I am your regular anchor, Ushwomowa Daniels. Our focus this week is on drug control, persons who are drug dependent, drug supply reduction, etc. First, let's take it through our news segments. For many participants here, men's health is often not talked about and given the necessary attention due to some social-cultural reasons. This situation has resulted in the death of many young men due to preventable diseases like prostate and testicular cancers. It is to change the narrative that this 10-kilometer walk from Lekki to Bodilon became necessary to raise awareness about men's health, especially on prostate and testicular cancers.
As you're getting older, the testosterone is reducing, and all of that is making the prostate gland grow. So it poses to be a problem when it turns cancerous, so it becomes malignant. But will the prostate enlarge? Yes, it will enlarge, and walking is one of the ways to keep it down.
God gives life, but exercise sustains it. These days, obesity is an issue. Life expectancy is not so high. So really, you need to be walking.
Just to waka, eat responsibly, get adequate sleep, hydrate enough.
Prostate cancer develop in men over 40 years of age, while testicular cancers affect men from 35 years, with risk factors like family history, environmental factors, and inactive lifestyle.
Prostate cancer, first of all, is genetic, and it also has a relationship with breast cancer. Any man who's diagnosed with prostate cancer means that the daughter is at high risk for breast cancer. So it's important that people test early. Early screening is very important for detection, because when detected early, it gives you a fighting chance. It's okay not to be okay. So let men stop dying in silence.
I find a lot of people trying to exercise and to run, but then it's very difficult for those who are not in an area where they can be able to exercise. My advice is for the federal government to support lanes and centers where people can go and exercise.
Apart from this walkathon of 16th November 2024 by the Waka Community International Foundation, with members from 57 countries across the world, they have carried out several activities in the past 3 years to ensure that men don't die in silence over preventable causes. Accidents could happen in form of cardiac arrest, motor accidents, building collapse, and other several ways. Whichever way they come, knowing the right steps to take in saving lives within the first 0 to 4 minutes as per se is critical to reducing the number of casualties recorded. This informed the first aid training for students and school teachers in Lagos State.
Training them on CPR, first aid, and other pre-hospital skills. The goal is to raise a generation of persons who do not take pictures and videos during emergencies, but are able to express some positive skills that would enhance the survival chances of such victims during such emergencies.
They say knowledge is power. It's when you have the knowledge that you can do those things. So this training is part of the answered prayers that we have been calling God for.
I've learned all the processes that has to be done when a person is in an uncomfortable position during an accident.
When we catch them young, as it were, it's going to spread, and that means that every time we have emergencies, there is someone somewhere that is attending to such a crisis.
The challenge of inadequate manpower in the nation's health sector due to worsening brain drain has also necessitated the need for first responders training.
We don't have medical professionals everywhere, but everywhere we have citizens. We have persons that even if you can't even offer CPR or anything, but you can make a phone call, you can call 767, you can call 112.
40% of all deaths we record in Nigeria happen prior to the victims or patients getting to the hospital. So it means that the capacity for people to stay alive will be improved when those close to them know what to do when emergency happens. Today's training is being sponsored by Total Energy's CPFA.
I want to employ everyone out there to join this crusade that Health Emergency Initiative are doing in saving life, and you don't know whose life you'll be saving.
So far, over 120,000 persons have been trained on emergency response across Lagos and other states of the Federation. The pharmaceutical industry is indeed critical to the economy of any nation, as well as essential medicines, following the COVID-19 pandemic lockdown that exposed how poor the nation's health sector was in terms of medicine sufficiency. There were commitments from various quarters to avoid future situations, but how well have these expectations been delivered?
I was thinking from the NAFDAC perspective, challenging our local manufacturers, not knowing that the pandemic will come, that how come that we are manufacturing only 30%. So Alhaji Yakasai and I started discussing.
He says that 70% of the drugs we use are imported. Who says so? More than 70% is now imported. Where is that going to take us?
Looking for who is at fault or who should have done what isn't going to get us anywhere. The Western world are not interested in our diseases. They are making medicine for specific genes, for specific people. So there is an urgent need for us to actually research and develop medical solutions for our particular needs.
Even though the dollar issue is what is really creating problem, fluctuation, so we look inward. So many local companies now, they establish a consortium to start producing pharmaceutical active ingredients. If we can do it here, it will create more jobs and the prices will really come down.
Achieving improvement in local manufacturing in the face of high cost of production and power supply that has driven many manufacturers out of the country was another challenge raised at this forum.
The issue of insecurity, the issue of infrastructure and electricity, energy, is one of the issues that I highlighted. But there are so many opportunities. I wonder what other foreigners will come and they will make it. Well, we sit back and lament.
Correct policies can only come when you have the correct leadership. So ultimately, it is a challenge to all of us to contribute in getting the correct leadership.
The need for expansion of import prohibition lists, establishment of petrochemical industries, and regulatory reforms also came to the fore.
A healthy population, people often say, builds a prosperous nation. But many Nigerians are threatened on a daily basis and die needlessly due to diseases, poor health care, malnutrition, and lack of access to relevant health information. The sorry state of our health infrastructure is also a major challenge. On Healthaffair, Oshomo Daniels brings these challenges to the attention of relevant authorities for a lasting solution. For sponsorship and advert placements, please call the numbers showing on your screen. Healthaffair, your access to good health through relevant information.
Welcome back.
The Child Rights Act 2003 defines a child as one who has not attained the age of 18 years. The Act provides all the rights and responsibilities of the Nigerian child, but either due to negligence and ignorance, most of these rights are often violated. In recent times, the Nigerian child is more than ever exposed to environmental hazards such as rape, child labor, and trafficking scandals. On this corner on Healthaffair, we are saying this must stop, and mothers must take responsibility for their children. Fathers and the entire society are not exempted.
Some families pick up their relative children, and at the end of the day you find out they're being maltreated. They have right, like your own children, to go to school. They have right to be treated when they are sick.
Not only people that are using people as house help. Some parents themselves, they are maltreating their own children.
We have physical abuse. When you physically harm a child, beat the child, and hurts the child. Then we have verbal abuse, when you use insultive words on the child that can affect the child's emotions. Sexual abuse. If you see any child, please report them to us.
We're looking at the issue of drug control in Nigeria. What is obtainable, the drug war situation, the neglected aspects of drug users, and the push factors. A recent report by the United Nations Office on Drugs and Crime in Nigeria indicates that 14.3 million people aged 15 to 64 years abuse drugs of various types. This increase in cases recorded is despite vigorous efforts by relevant agencies to tackle the menace of drug abuse. While the battle is far from being won, and reasons to decriminalize drug abuse and reduce harm on drug-dependent persons is our focus on the show this week.
Since we get independent and came out with our drug policy, punitive drug policy, the truth is, does it reduce drug use? People have been sent to prison. People have been put into jail. But does it really reduce drug use? If a drug user is infected, is there no possibility of it getting to somebody who is not a drug user? Or this drug user you are talking about, it could be your relation, it could be mine. They come from a family, they come from people. But the problem there is people do not understand that drug disorder is a sickness and not a crime. The same way somebody that have diabetes need help is the same way that somebody that depends on drug need help. So it's high time we start looking at it from a public health angle. We have like 3 pillars of drug control in Nigeria. We have the supply control, we have the demand control, and we have harm reduction. So we've worked so much on the demand control and the supply control. I think it's high time we all now focus on the 3rd pillar, which is the harm reduction, the health, how to give this person treatment. If you check into the prison, you will see young men that have been arrested with 1 wrap of Indian hemp, 2 wrap of Indian hemp. Most of them are maybe year 3 student, year 2 student, and the language in cell. It would have been better if you give them treatment and reintegrate them into the society. But what do we expect when they come out of the cell? Their parents are frustrated, they themselves are frustrated. Do we expect to have good citizens? I am a living testimony to harm reduction. We have peer influence, we have societal influence, we have family influence. No human being was born like a drug user. But something happened along the line. You see a young man, he's a graduate, no work. It becomes a disappointment to the parents. People start seeing him as frustration, as being a frustration to the people. How do I escape from this pain? Maybe another friend would advise him, take a tablet of tramadol and sleep. Ignorantly, he doesn't know that there is tendency of being addicted to tramadol. And if you start maybe with 50 milligrams, there will come a time the 50 milligrams will not work again. It will go to 100 milligrams until the person gets addicted to it. The current bill going on now of the death sentence concerning drug use, are we sure it's going to give us a positive answer? Or it's going to make the community more hardened than how they are, and we keep facing problems? So my appeal is, can we start looking at the issue of drugs from a public health angle? Treatment, prevention, giving these people capacity to understand what they are into. Because a lot of people that goes into drugs do not even know the side effects of it until they get addicted and dependent on it. And at that point, they are not in control of their life. So whatever you are telling them does not really make any sense. All they need is treatment. They need care. They need a psychologist to take care of them and advise them well, and you will come out to see them become a very good citizen of this country. Killing our brothers, killing our son, killing our relations because they have a problem will not be a solution.
It's about communications. Even these government policies and all that, it's about communications. That's where we are not getting it right. So you could be doing something to help somebody to live better. But because you're not able to communicate that thing to the person in the language in which the person would understand, the person will reject you, will not listen to whatever you're saying. That's one. Two, sometimes if you use force to try to force somebody to stop something without giving the person a background on why the person needs to stop it, one, and then give the person an alternative. What else do you want me to do if I stop this thing? This thing is helping me in some certain ways to overcome some certain things that are bugging me. What alternative do I have? So when you force me to stop it, and you don't give me an alternative, what do you think will happen to me? I will become worse off. So the main issues that is making a fight against drug use, drug abuse, drug trafficking, and all those things is mainly about communication. We just come and put laws there. Nobody is communicating to anybody. There are people who want to stop. Who is telling them what to do to stop?
As a country, part of the things we should even look at is the policies. Who are bringing up these policies in the first place? Are we implementing these policies? Because, for example, there are policies around national HIV guidelines. Recently, the harm reduction policy was also approved. This policy goes a long way to define how to care for persons who use and inject drugs. Drug-related issues, a drug dependency issue, is not a criminal issue. And it is clearly spelled out in the intervention we do. Enforce laws that, and you begin to bring up laws without contributions of the community, it means clearly that you are not going the right path. And the way you look at it is not the way the community sees it. If we begin to carry out advocacy, and these advocacies also go a long way in changing the minds of the policymakers around these drug-related issues. And the drug-related issues, if as a country, and if you look at certain people in the society, and you look at it clearly that a drug user, it is not written on the forehead. A drug user is not a criminal. It's not a useless person. Being useless is something that has nothing to do with drug use. I would like us to unite as a country. It is not because you are not a drug user today, it is none of your business. Everybody in the country uses drugs. Yes, even somebody that drinks alcohol. Alcohol is a drug. So if we look at it clearly, we'll see that this is a general issue. It is not just a one-sided issue. It is not an issue that should be driven by drug users alone.
If you are just joining us, it's Healthaffair on AIT, and next on the program is our nutrition segment. That aspect of the program that is concerned about you eating right to stay healthy.
Scent leaf, commonly known as clove basil in English and efirin in Yoruba, is a strong aromatic herb native to Nigeria, Ghana, and some parts of Africa and Asia. It is found in farms, gardens, and mainly used as a spice for cooking delicacies due to its aromatic taste. Scent leaf has antibacterial activities against Staphylococcus aureus, Salmonella, and Candida albicans. It is also a repellent against houseflies, mosquitoes, and other insects. As a vegetable seasoning, it gives every meal a delightful, unique, and sweet taste. From research findings, there are numerous health benefits from scent leaf. Scent leaf aids digestion. It helps bowel evacuation and weight management. It can be used to treat oral infections as it kills all bacteria in the mouth which cause tooth decay and bad breath. Scent leaf is used in the treatment of fever, cold, catarrh, as well as skin infections like ringworm. Scent leaf has antibacterial activities against Staphylococcus aureus, Salmonella enteritis. Extracts from scent leaf has also been reported to lower blood pressure, blood sugar, and potent for the treatment of gastroenteritis and lots more. Scent leaf can be taken as a tonic. It can be taken like salad or added to dishes during cooking.
On our clinical segment, we give you tips for healthy living.
People should generally create a culture of coming to the hospital to check their kidney function, to do a kidney function test, and make sure that their health are optimal. Because at the end of the day, if it gets to stage 5, it becomes irreversible.
We appreciate your contributions on our perception segment on how to improve human lives and the nation's critical infrastructure. To be a part of this segment, you can call the numbers showing on your screen.
The church is looked up to by a lot of Nigerians to speak truth to power. And we have seen that we used to do that, but now we're no longer doing it to a large extent. Our leaders' voices are no longer sound enough to caution those in power. And it is important that we trace back our steps and begin to do the right thing. So it is important that the church will come back to the track and speak truth to power. And then we will restore confidence in a lot of people, the young people, the aged, the women, the youth, and the children, that we are doing our work as religious organizations and in the best.
This is how we draw the curtain on the program this week. Thanks for spending your time with us. Let's do it again same time next week. I remain yours truly, Ushuomowa Daniels. Please don't forget to advertise your health products and services on the program.